welcome to AYD. This is our medical and surgical facility. It is not new to you, but it's just been refitted and refurbished. Come on right in and we'll give you a sneak peek of how this new wing looks like now.
Dr. Yong, tell us a bit about the inspiration behind this new wing.
We actually now have an aesthetic wing, which is downstairs on level 2. So the whole purpose of fitting this out was really to facilitate our medical and surgical patients, because we do see a range of cosmetic, medical and surgical dermatology patients. So what we really did was that we kept to the same theme that we've always had for the last 2 years. We just gutted out the back rooms and sort of like consolidated them into like bigger format rooms, which allowed for more convenience and ease it during our surgical processes, so that there's a lot more space. Patients can be really comfortable when waiting, family members as well.
Dr. Yong, I see that your clinic waiting area for the patients has been expanded significantly. Can you tell us a little bit about it?
Sure. Okay, so what we used to have was almost 5 to 6 rooms in like this confined space. We used to have a closed door here and then sort of 2 rows where we had smaller rooms. So what we did was that we gutted out the back rooms and we sort of consolidated them into like 2 or 3 big format rooms now, and that allowed us to push all the rooms to one side, open up an entire corridor, which became then a new waiting area. So instead of just having like a small pocket here where patients could wait in the front, now we have extended the waiting area all the way to the very back. And this allows us to break up patients to various small groups, so taking into account social distancing rules, but also allowing like patients to wait separately and have things like financial counseling done with our nurses in privacy, also allowing them to sort of have a pocket of space where they can sort of wait while like a relative or friend that they're accompanying may be having a procedure done.
And Dr. Yong, we heard that there's something really unique about AYD's new setup. Can you tell us about it?
Okay, let's have a look and you will see what we mean, right? So over here, we see a huge expanse of space, largely because the rooms are completely transparent and see-through. This is something we call magic glass. It's been fitted across the entire length of the space. So this is my consult room over here. So I use it to consult with patients, go through the history, the examination, go through like the consent form process as well with procedures. But sometimes we need privacy for this thing. So with the touch of a button, this is what happens. Let's go on right in.
Dr. Yong, are there any new services that patients can look forward to in this place?
Right, so this is the floor that we have our procedure rooms in. So of course we subspecialize in most micrographic surgery and cutaneous reconstruction. So we have our procedures entirely done here, along with other cutaneous dermatological surgery. We also do our hair transplant procedures here, and the rooms are fit out perfectly for both the harvesting as well as the implantation stage.
You mentioned the procedure rooms. Can we have a look at them?
Sure, let's come on right in. Let me bring you to our procedure room 1. So this is our first procedure room. It adjoins the consultation and the examination room behind that, connected by a sliding door, allowing us easy access once patients are ready. So what we have here set up is really meant for cutaneous surgery, most micrographic surgery, which is what we specifically do for skin cancer cases, the local regional flap and graft repairs that we do with the closures, as well as other cutaneous surgeries like excision of lumps and bumps. We can all facilitate that within this procedure room. This is really well set up. It's got perfect lighting. This is an operating room light, as well as operating room table as well, with allowing us to adjust the patient in the perfect position, up, down, in various sort of like prone or supine positions as well. This is set up with, of course, all our equipment in place. They're all racked and stacked like underneath the cabinet sinks, and we actually sort of have all our equipment from like our sutures to like the other consumables all already within the cupboards you see behind us.
Dr. Yong, tell us about the next treatment room that you have.
Okay, so behind another sliding door that you can open with a wave to prevent yourself from touching that, especially between cases. This is our second procedure room. We do a lot of our hair-related cases here, but it's also set up as a second procedure room in case we need to sort of use both rooms for separate patients. So over here is where we do the implantation for hair transplant cases. The harvesting is usually done in procedure room 1. And then when we do implantation, we prefer patients to be in this position, comfortable in like a dental chair. And these are overhead lights. This is a double fork lighting as well. This allows us to sort of like angle the lighting in the perfect position, allows the team of staff with me to get optimal lighting as well, as we don't have any shadows cast when we utilize lights as such. Behind me as well are all the microscopes that we use to facilitate most of our surgeries. There are like 3 scopes here that we use for hair transplantation procedures. We use it to sort grafts, to micro dissect grafts as needed for strip or FUE cases. And this is my other microscope that I utilize for my most micrographic surgery. This is my scope that I use to read the histological slides as well. So this is where we actually prep and set up for microscopic work.
Dr. Yong, what happens when a patient has completed their procedure? Where do they go next?
Sure, so as you've seen the 2 procedure rooms, they're all set up perfectly for the procedures that we need to do. Patients obviously need a place to rest in between procedures as well. I'll show you the room right now. This is our small mini recovery room. It's just here next to the procedure rooms. It's got space for somebody to relax in, read a book, sort of watch TV if they would like. As I mentioned before, our procedures can be quite long and there's a bit of waiting time in between, so this space can be given to the patient to recover and to get dressed in as well. I think the key thing is that we've always wanted to build everything under one roof and under one umbrella, but yet allow sort of space for every treatment to be customized. So we actually handle a lot of cosmetic, surgical and medical patients, and the reason why we have 2 wings is to really allow optimal treatment rooms set up for all the procedures that we need to do in one house. So what we want to do is to really ensure that patients have holistic, individualized head-to-toe skincare, and we manage everything from the medical aspects of dermatology to the surgical aspects of that as well.
Where can a patient go to find out more about AYD?
You can go to our website www.ayd.com.sg to read out more about the procedures that we offer, and also follow us on our social media pages.
Thank you so much for the tour, Dr. Yong. See you.
Thank you. See you. Bye.